Hello guys, today we are going to talk about the triangles of neck. So basically we have two triangles of neck. They are anterior triangle of neck and the posterior triangle of neck. And there are some muscle present and these muscle forms the triangle of neck. So here we have the sternocleidomastoid muscles and this run all the way from back of the head to here, and also we have the trapezius muscles, and this is called the omohyoid muscles, while hyoid bone is here, and this structure from the triangles of neck. So the and so the anterior triangle of neck, this is the anterior triangle of neck. As you can see here, this is the triangle like structure, and it is on the anterior side to the neck, so this is called the anterior triangle of neck. Also there's another triangle like structure here, and this is called the posterior triangle of neck. So these two triangles are separated by the sternocleidomastoid muscles. As you can see in the picture, this is the sternocleidomastoid muscles, and it has run from the back of the head into the clavicle. So, and this is the trapezius muscles, and this muscle together form the triangle like structure here. So this is the posterior triangle of neck here. This structure resembles to the triangle, so this is the posterior triangle of neck. Also here we have the anterior triangle of neck. This structure resemble to the triangle, so this is also known as anterior triangle of neck. So before we get started, let's learn about the origin and insertion of some important muscle first. So let's start with the sternocleidomastoid muscle. So here's the sternocleidomastoid muscles, and as you can see it has two head. The sternal head, this is the sternal head, and this is the clavicular head. So it has two head, and the sternal head origin from the manubrium sterni, and the clavicular head, this origin from the medial third of the clavicle. So this is the clavicle, and this is the medial third of the clavicle, while the other are the lateral third of the clavicle. So the clavicular head origin from the medial third of clavicle, and it extend all the way up. So this extend all the way up, and then it inserts into the mastoid process. So here's the mastoid process, and it inserts into the mastoid process. The trapezius muscle origin from the back of the head, that is external occipital protuberance. So on the back of the head you can see external occipital protuberance as in picture. Also there is a superior nuchal line, so most of the muscles of trapezius origin from there, and it extend all the way down from here and inserts into the lateral third of the clavicle. So this is the lateral third of the clavicle, and also it inserts into the acromion of scapula and the spine of scapula. So you can see in the picture this trapezius muscle, it's big muscles, and it has origin from the back of the head, that is superior nuchal line and the external occipital protuberance, and it extends all the way, and some of them inserts into the lateral third of the clavicle, also acromion, and also the spine of the scapula. And the next one is the omohyoid muscles. So here's the omohyoid muscles, and it has inferior belly of omohyoid muscles, and this is the superior belly of omohyoid muscles. So it origin from the superior border of scapulas and inserts into the lower border of body of hyoid bone. So as you can see in the picture, this origin from the superior border of the scapula here. So behind this muscle there's a superior border of scapula, and it extends all the way here and inserts into the lower border of hyoid bone. Now let's talk about the posterior triangle of neck. As posterior triangle of neck is formed by the trapezius muscles, sternocleidomastoid muscles, and the clavicle. So when they are joined together, they form triangle-like structure. So let's see the boundaries of this triangle. So in the front, as you can see the sternocleidomastoid. So front is the sternocleidomastoid, and this is the behind, and on the behind is the anterior border of trapezius. So these are the anterior border, while these are the posterior borders. So behind is the anterior border of trapezius, and base is formed by the middle third of the clavicle. So here's the base, and this is formed by the middle third of the clavicle, while the apex is formed by the apex is formed by the meeting of trapezius and sternocleidomastoid muscles. So as in picture, so this form the apex. The floor is formed by the semispinalis capitis muscle, splenius capitis muscle, levator scapulae muscle, and scalenus muscles. So imagine here's the floor, these are the floors, and these are formed by these muscles. And you can remember with mnemonic SC, because there's a SC in all muscles. And the roof is formed by the skin, superficial fascia, platysma, deep cervical fascia. Now this posterior triangle of neck is further subdivided into two triangles by inferior belly of omohyoid. As you can see in the picture, this is the posterior triangle of neck, and when this inferior belly of omohyoid passes through here, it is divided into two triangles. So the upper one, it is called the occipital triangle, and the lower one, it is called supraclavicular triangle. The lower one, it is called careful triangle because it contains many important structures like branchial plexus, third and fourth cranial nerves, and subclavian vessels. So what are the contents of these triangles of neck? Well, these triangle of neck may have important nerves, blood vessels, and lymph nodes. That's why they are important. So let us first see the knobs present in the triangle of neck. So in the occipital triangle, there is an important nerve called spinal accessory nerve, and it also has four cutaneous branches of cervical plexus, which are greater auricular nerve, anterior cutaneous nerve, lesser occipital nerve, and supraclavicular nerve. And you can remember this with the mnemonic GALS, GALS. Also, there are nerve branches that supply the muscles such as levatus scapula, trapezius muscle, and rhomboideus muscle. And there is also root of branchial plexus, C5 and C6. So these were the knobs present in the occipital triangle. While in the supraclavicular triangle, the knobs present there are three trunks of branchial plexus, knobs to serratus anterior, knob to subclavian, and supraclavicular nerve. So these are the knobs present in this triangle. While the blood vessels present in the posterior triangle of neck are, in the occipital triangle there is the transverse cervical arteries and vein, and also occipital arteries. And the blood vessels present in the supraclavicular triangle are subclavian artery and vein, and supraclavicular artery and vein, and the lower part of external jugular vein. So these are the blood vessels present in the posterior triangles of neck. Also, the lymph node present in the posterior triangle of neck are, in the occipital triangle there is the supraclavicular lymph node and occipital lymph node, and in the supraclavicular triangle there is supraclavicular lymph node. As you can see in the picture, there are nerves, blood vessels that are arranged in the triangles of neck. So in the occipital triangle, the nerves present are the spinal accessory nerve and the four cutaneous branches of cervical plexus, that is greater auricular nerve and the anterior cutaneous nerve, also lesser occipital nerve and supraclavicular nerve. Also there are nerve that supply the muscles such as levator scapula, trapezius, and rhomboideus muscles. And there is a C5 and C6 root of branchial plexus. It's not being shown here. And the nerves present in the suprascapular triangle are the three trunks of branchial plexus here. So these are the three trunks of branchial plexus. And also there is a nerve to serratus anterior, which is not being shown here. And there is a nerve to subclavius, as in here. And also there is a nerve for suprascapular nerve, so it's in here. While the blood vessel present in the occipital triangle are the occipital artery, the transverse cervical arteries and vein are not being shown. And in the supraclavicular triangle we have the subclavian artery and vein, and And also there is the supraclavicular artery and vein and lower part of external jugular vein.